Okay, so this starts the formal part of our echo. We went through the informal part. So hi everyone. We'll start. If you haven't done or if you haven't already done so, please register for this session by clicking on the registration link in the chat. Thank you. So it's officially noon, and we'll get ahead and get started. Thank you for joining us for the Project ECHO COVID-19 session during this unprecedented and challenging time. I'm Petros Levounis, and I'm a professor and chair at the Department of Psychiatry at Rutgers, New Jersey Medical School. I will be facilitating this afternoon's discussion. For anyone new to Project ECHO, the rapidly changing situation with COVID-19 necessitates a responsive, fluid, and interactive communication strategy. Project ECHO fosters partnerships between experts and frontline healthcare providers. It is based on education, begins with information, and extends to better outcomes. Today's session was specifically devised for frontline providers in outpatient settings. For anyone who's familiar with the Rutgers Project ECHO telemedicine clinic offerings, due to shifting priorities, we have changed our previously scheduled topics in order to focus our resources to a response to COVID-19. The purpose of today's session will be to provide information on how to take care of healthcare workers and overall address resilience in the time of COVID-19. We appreciate all of the questions you submitted to us upon your registration. We're sensitive to the urgency of your requests, and we're going to make an attempt to answer as many of these questions on this call. We have had over 1,200 questions submitted. The Q&A feature is also where you will be able to ask questions during the session, which will be compiled and presented to the speakers after the presentations. There will also be a significant amount of time devoted to questions and answers at the end of the session. Thank you for your participation. I hope we can have a rich discussion and ensure your patient care questions are answered during our time together. To introduce you to your technology today, if you have not already registered, we ask that you register using the link in the chat. This session is being recorded and will be distributed and posted on the Rutgers Project ECHO website after the session, including any links and resources shared during the presentation. Finally, as the timeliness of this content changes with each passing day, if you are viewing this recording at a later time, realize that this may not be the most current information at the time you are viewing it. Note that information on websites for the New Jersey Department of Health, CDC, and COVID-19.nj.gov as resources for healthcare providers are provided on our New Jersey Project ECHO COVID-19 webpage. And with that, I do want to introduce our speaker today, Dr. Rashi Agrawal, who is an associate professor of psychiatry at Rutgers New Jersey Medical School, and also the program director for a residency training, and also a great friend of mine. So I'm absolutely delighted that she's going to be giving our didactic portion of the ECHO session today. Rashi?
Thank you, Petros. Let me start by the technology part, which is sharing my slides. This is the most stressful part of the talk for me. One last thing left. All right. So thank you everyone for joining us today. This topic is very dear and near to my heart, how to take care of ourselves. I only have one disclosure, which is that this talk is not a substitute for actually taking care of ourselves, for having the PPE we need, for having our needs met by organizations we work for. And, I was so gratified to review the questions that were submitted, because many of you are asking about how to help take care of others, our colleagues who are on frontline versus us. And I have one request for you. As you listen to this talk, first, try to apply what I'm talking about to yourself. Do that first. And then, of course, we are all here to take care of our other colleagues who might be in situations more stressful than you and I are. With that, the roadmap for today, we need to talk about taking care of ourselves, but we need to talk about it in the context of what was already happening in the world of medicine. And then we will talk about how COVID has impacted us, what is the impact on people who are on the front lines, and what are the lessons we have already learned from our past experiences and how to apply them. So it's not a surprise to any of you who are listening into this that burnout for physicians, nurses, social workers, counselors, anyone who takes care of patients in medicine, it was a thing, a big thing, even before COVID-19. Not only there is a high rate of burnout, burnout among doctors is talked about a lot, but there is burnout in almost every professional that participates in medicine. So there's high rates of emotional exhaustion in nurses, there is high rates of depression. Physicians die twice at the rate of a general population. So we all understand that these are things we have all been struggling with long before COVID came. And then, of course, came COVID. Um, what it brought with it was a lot of chaos. And depending on your setting, things might have been a little bit different, but chaos and uncertainty has been a common theme. For those of us who work in inpatient settings, in the hospitals, the emergency rooms, there has been a surge of patients and the workload has multiplied. There has definitely been a lack of resources for all of us, right? Wherever you work. Most of you had to transport your day-to-day work of in-person work to tele within like a day or two. It has been really unclear throughout this process if we will have enough PPE or not. And that has come with conflicting guidelines. So I remember just a few weeks ago where residents from my department and others were cited for wearing a mask in the hospital, and they were told by administration, no, this is not something to be done. You're doing bad stuff for patients where you're using the same mask. And then, of course, from our daily practice of using a mask before and after every patient that was on any kind of contact precautions to using a mask every day, which has become the rote now. So the guidelines which conflicted day to day, especially in the beginning, cause a lot of stress. And this obviously is happening hand in hand with the fact that for healthcare professionals, there's a lack of trust in organizations. We don't know if the organization we are working for will take care of our needs or not. And of course, those of you who are in education will know that this is a real life impact on residents and students and anybody that is in training, because everything has come to a screeching halt or moved to tele. So in this context, the most important life lesson, which was, it has literally become put on your own mask before assisting others. And seriously, you can't help others if you are sick or dead. Now more than ever, each of you needs to realize that your own self-care is a priority and necessity in the work you do. It's not a choice, it's not a luxury. So what does that mean? Staying well really means fostering well-being and resilience in ourselves. And what does that mean? Well, well-being, simply put, it's really having a frequent positive affect, having a high life satisfaction, and having infrequent negative affect. Meaning that yes, you and I are humans and we will be sad some days and happy some days. But if I ask you to stop and think about how satisfied are you with your life today overall? So you might have had a bad night because of a small baby keeping you awake, or your work, something happened and there was an emergency. But if I asked you to stop and pause and say, not about today, not about yesterday, overall, how satisfied are you with your life? And if you're able to say, overall, I'm happy, that's what this well-being means. By the way, that's also the definition of happiness. So when we talk about well-being, we are talking about the concept of deep-seated happiness that is universal. This topic of well-being and happiness goes hand in hand with the term resilience, which just means that you have a high ability to adapt to and bounce back from the stress of the clinical environment. And you can do that if you have a high baseline well-being scores, right? And when we're talking about resilience or measuring resilience, we're talking about well-being, life satisfaction, qualities like being optimistic, happy, and self-aware. And the reason all of this is so important is that there is a big emerging literature that shows that high resilience is associated with better physical health, lower morbidity, less pain, longevity, and in times like this, not to highlight this too much, but there is improved immune function association with high resilience. Now, when I talk about these terms, it might seem that I'm saying it's your responsibility. It's my responsibility for my well-being and resilience. And in part, that's true. However, just also let's remember that most of us who come into the field of medicine come in with high levels of resilience. So, why do we all get burnt out? It is the organization around us. It's the way healthcare system is structured. So, um, even though we'll be focusing on individual resilience today, I really want to highlight that burnout, there's enough studies that have shown that burnout is a systemic and organizational problem. So yes, interventions work. Interventions work whether you make organization focused changes or individual focused changes. However, organization focused changes are much more powerful in decreasing the stress and anxiety and improving the resilience and well-being of doctors and nurses and everyone. So again, organizational interventions for promoting well-being are really, really important. But let's also focus on today, individual interventions. So just because I'm only focusing on them, I again want to say it's really organizational interventions that also need to come in play. So what can you do? First step, recognize and acknowledge what you're feeling. Emotions are a crucial part of our human nature, and we need to recognize and explicitly name them. Now, many of you on the call are psychologists, counselors, social workers. We work with patients, and we normally think of, hey, this is something we are familiar with, this we know. But just think about it, are you applying it to yourself? Because to help others process their emotions, you have to acknowledge your own emotions first. And especially in a pandemic, common emotions that we are dealing with are grief. And when we talk about grief, we are very used to thinking about loss as a reason for grief, death in family, death of patients. But grief is also something that comes in play when you're just thinking about losses as a whole. So think about it. Who amongst us hasn't experienced a loss of how life was just a month ago? It's completely different today, right? Anticipatory grief is something that is not talked about that much, but it is a grief and anxiety and sadness you experience when you're anticipating major changes. Most of us have also felt this in some way or the other, and it takes a little bit of time to understand why you're feeling this. Just speaking from my own personal experience, it happened to me a few weeks ago, where I was just very, very sad, and it took some time to figure out what was making me sad. It was anticipation of changing things for my residents. So anticipatory grief is a very real thing. There's also anger, fear, helplessness, and guilt that all come in play. So just in the last 1 week, I've been speaking to two colleagues who are doing so much in the organization, who were both telling me that they felt guilty. They felt guilty that they were not on the front line because they are not an EM physician. And it is so interesting to think about these two people who are leading and influencing so many people feel guilty for that. I feel guilty that I'm seeing some patients that are positive, but my residents are doing more. My residents might feel guilty that, hey, they are seeing a lot of patients, but they're not really the EM resident or the medicine resident who's in ICU. The medicine resident, the EM resident, might be feeling guilty, or the nurse in the EM emergency room, that even though they are working so hard, they are still losing patients. They can't save lives all the time. So guilt and fear and anger are universal emotions, and we tend to downplay our own emotions and say, hey, my feelings are not as important as yours. So acknowledging and naming your emotions is much harder than it looks. And most of you are aware that when we are dealing with emotions that are a little bit difficult to deal with, unconsciously, consciously, we try to use defense mechanisms to deal with them. And some of you might think that defense mechanisms is something that our patients use, and not be that aware that all of us use them. Immature defense mechanisms. In high stress work situations, one nurse shouts at another nurse, or one resident says, it's not my problem, it's your problem. Those are all immature defense mechanisms that come in play when we have a high degree of stress. I want to highlight some of the defense mechanisms that are useful to use in these situations, which are called mature defense mechanisms. Anticipation, which is really realistic planning for future discomfort. And an example of anticipation gone wrong is just the example of the toilet paper running out of stores. This is because people were preparing. They knew there is an epidemic. And while preparing in a realistic manner, some of our colleagues sort of went overboard. The other three are really very important defense mechanisms for us in medicine. So let's talk about them. Altruism and sublimation, basically taking care of others and putting others' interests before ours, are a part of our lives. And we took the oath, but this is real, right? Like, it's not just that I am putting my life in danger if I'm seeing patients who are infected without proper PPE, but I'm also putting family members' lives in danger, which makes it worse than any situation we have ever encountered. The challenge with altruism and sublimation is that even though we instinctively use them, one, because almost all our work is this, we sometimes then forget that what our work is actually doing is really helping an individual. That focus goes away in a day-to-day life of writing your notes and doing this and that, right? So taking a moment to connect to what is the meaning of what you're doing and how it actually helps is very powerful. The other problem with altruism and sublimation is that because the healthcare systems have had problems, many of us also feel a little bit cynical that our ability to give has been used against us, and we're being asked to see more and more people in shorter and shorter times, and some of us feel that we are being taken advantage of. So it is a little bit of a loaded one, and you need to pay attention to how you are feeling about it. And because exactly of this loading associated with this, I think appreciation goes a long way. And each of us find different kinds of appreciation valuable. You know, people applauding, people saying thank you to doctors and nurses, and the counselors and the social workers who are really doing the work of medicine every day. But also, you know, personally speaking, for some of my residents, I think Krispy Kremes has been the most popular appreciation. But for you, it might be the gas discount or Starbucks. Like, we all need to be appreciated and feel appreciated for the work we do. And it becomes even more valuable when you're putting your life in risk. This talking about different emotions and how we use defense mechanisms really is put into context if you look at how we respond to phases. So in some ways, we've already crossed this one, right? This was a time when we were anticipating, when we had anticipatory grief, anger. And this is where we're sort of reaching now right here. So altruism, sublimation, this is what we signed up for. We are going to help others. This is where we have been or are around. And now people are already talking about layoffs in medicine and tightening our belts in medicine when we've been all doing what we're supposed to do. And there creeps in the disillusionment. Again, these phases are not each of us is tied to each of these phases, and you can have a crossover of emotions at all times, but it's a nice way to see how we might have each walked in this journey and where we are. When we're talking about altruism, sublimation, and our role in medicine, I think one other important concept to talk about is really what gives life meaning. Meaning in life is derived from, are you living your life based on your values? And for us, it might be, you know, because we're talking about medicine, you might think only about work, but it means both in our personal lives and in our work lives. And based on your values, what is your purpose? What do you really want to achieve? And it's not enough to say, hey, I want to help people or heal people. You actually have to be good at what you do, so efficacy. So you came into social work, you came into medicine because you wanted to help people. Now, if you're good at your job, if you're efficacious, that gives you a sense of self-worth. So combined with values, purpose, and efficacy is the self-worth, and that's the sum total of what gives life meaning. And it can change depending on your phase of life. But keeping this in mind as you do your work, it becomes less of a job, but more of your life's purpose. Most of us are healers. That's why we came to medicine. Healing others gives our lives meanings. For many of us, healing might also mean healing our healthcare systems. And there comes in the role of advocacy, speaking up, making changes, not just for your individual patient, the one person you want to help, but also making changes in the systems we work in. Regardless of how well we manage our emotions, some situations, humor is the best defense mechanism to use. And I really, really envy those of my colleagues who can make a joke that makes everyone laugh. I'm not very good at that. I just wanted to point out the second cartoon. I've been driving for work for some time, so it took me some time to understand this joke, but I'm assuming those of you who use a subway or a train will find this touching. But using humor is a very powerful defense mechanism, and that's why there's so many doctor and nurses joke, and it's healthy to do so. Regardless of how well we use humor, our work situation and work lives are stressful. Our colleagues have a lot of stress and anxiety. So what are some ways to manage it? Now, a month ago, if I was doing this talk, the picture I would have used would be of this rattlesnake. You see this rattlesnake and you go into fight or flight mode. Nowadays, I think the picture to induce anxiety and the fight and flight mode is somebody sneezing close to you. What happens when you have the stressor? So when you have a stressor, what happens is your amygdala takes over. It works very fast. So prefrontal cortex, that doesn't take that long. You're talking about a minute or so, but that's too slow when you're in a life-threatening emergency. The problem is that amygdala does not understand the difference between actual life-threatening emergency or our day-to-day life stresses. So anytime there's a stressful situation, it goes into overdrive. And when it goes into overdrive, it stimulates an autonomic nervous system, which basically increases your heart rate, increases your blood pressure, makes you feel stressed and tense, and you do not want that. So what do? How do you break the cycle? The simple way to break the cycle is to stimulate your parasympathetic nervous system. Basically, you want your heart rate to slow down, your blood pressure to normalize, and there's a lot of things, like there's a lot of stress-related disorders that we are all familiar in medicine that happen if you're using this too much every day. So what is the most evidence-based ways to stimulate your parasympathetic nervous system? By the way, as a joke, I have the alcohol there. And again, occasionally a glass of wine here and there is a very useful way, but not the recommended way. And I'm sure Petros is smiling right now. So how do you break the cycle? The two most evidence-based ways that I want to talk about for a few minutes is deep breathing. Now, those of you who are listening in and who know how to meditate, I would like to say continue to do it. Wonderful. It is the best thing you can do to manage stress. For most of us who are on this call, meditation seems a little bit difficult and very time consuming, especially when you are overwhelmed. So the other evidence-based way to do that is deep breathing. There's a lot of evidence that if you use voluntary breathing, we are all breathing right now, but taking a minute to pay attention to how I'm breathing, how you're breathing, is called voluntary breathing. So the one exercise that I highly recommend, and I'm speaking as someone who tried to meditate multiple times and found it too difficult. What I found useful is really called diaphragmatic breathing or abdominal breathing. You take a deep breath, you let your belly go out, you expel, and you feel your belly go in. It's useful to put a hand there. So put the timer on your phone for a minute, and then just breathe every time you breathe, count from 1 to 10, and keep your eyes closed during that time. What you will see is you'll be like 1, 2, oh, what's my next thing after this talk? When am I eating lunch? Oh, I stopped counting. And you go back and start counting 1, 2, 3. If you're able to reach 10, start from 1 to 10. The more you do this exercise, the easier it becomes. And just 1 to 2 minutes of pause in a stressful situation. You can do this anywhere, in a restroom, in an elevator, in a corridor, or right before inviting a patient into your tele session. It will calm you down. This is the most evidence-based and the shortest method that I can recommend. The other method that is highly evidence-based is enhancing your positive emotions. And the positive emotions are optimism, gratefulness. Gratefulness is the easiest one to practice, and you can do it in many different ways. One simple one is just give yourself a minute and make a list of everything you're grateful for. And when you make that list, you will see I'm grateful for my family, my kids, my health. And then as you look at that list, you start thinking and adding things that you might be grateful for. For example, I'm really grateful for the internet connection. I can't tell you the number of times either the voice doesn't work or the video doesn't work. And when you're going to give a talk, the most anxiety provoking thing is, will everything work? So I'm really grateful for that today. I'm grateful for you all joining in. So, you know, start thinking about things we take for granted. Grateful for sunshine, the beautiful trees, like all the things that we sometimes take for granted. So paying attention to what you're grateful for will also increase your resilience and ability to deal with stress. Staying connected, even though we are supposed to have a social distance, just remember that's a physical distance, not actual social distance. So staying connected, even more so with friends and family, and staying connected with other people who understand our work. So here is a physician support line number, but staying connected with peers is really important. And then don't forget the basics. Eating, exercising, and sleep are the basics of self-care. Though I do have to say, everybody talks about healthy eating, and yes, it is very important. But if you're in the peak of a stressful situation, occasional unhealthy eating, don't beat yourself too much. It's okay. Accept the occasional donuts, and that's fine. Again, as much as you can, but if you have to choose one out of these, I think sleep is the most important one. You cannot eat or exercise if you're exhausted. Staying informed is important because that's how you plan, but too much of news is almost toxic. So if you have set up, notifications for news, don't. Just have a fixed time of a day where you go and look at your news. Don't do it all the time. Most news is negative, and because that's what sells, but that's not true of our situations. But that's how we start feeling when we read too much news. So if you can only do one thing, practice at least one self-care activity for yourself every day. And of course, if you can do more, and many of you want to do this, you want to help one other person, not just your patients, not just your clients, but your colleagues. I have a list of resources in these slides, which I know you will have access to. So I'm not just going to talk about these, but just know that if you're looking for resources for peer support, if you're looking resources for helpful apps that will help you breathe, humor, exercise, support for patients and children, you will find all those resources here, including resources for local help. So there are all kinds of numbers and links here. And I'll be happy to answer any questions you have. Thank you for listening.
Okay. Thank you so much, Rashi, for a wonderful presentation. So much needed these days, more than anything else. So, wow, we have 650 participants. I think that's a record for ECHO. And let's start with our questions and answers. So we do have some questions already asked. I've read the articles by doctors and nurses saying the appreciation feels hollow when there is not practical support in the form of adequate PPE, reasonable caseloads, etc. Could you please comment on that?
That is such a valid point. And that's why, when I was talking about organizational interventions are important, if we were doing a talk on burnout overall, what I would say is that appreciation just by words does not mean much unless it's followed by evidence. So appreciation does mean that we need our hospitals, our leaders to show they care about us. And that today really means actual honest communication about what kind of PPE is available, what is optimal to use, if you're working at 12-hour shifts, here is water and coffee for you, here is food for you, how can we give you rest and breaks? So actually providing all of that is absolutely important. So, if I'm working 12 hours without food, without any breaks, no round of applause will make me feel better. So absolutely. Thank you for raising that.
Yeah, I just want to make sure that I've also introduced Dr. Clement Chen, who's our clinical pharmacist here, and is also part of the panel. And Clement, of course, if you have any comments, please jump in. And first, unmute yourself if you want us to hear you too.
Thank you. Yes, I just kept myself muted. Yes.
Okay. I like very much how Rashi often talks about this in terms of the institutional wellness and the personal wellness, and the two go hand in hand. But certainly that side of the institutional wellness of practical things that the institution needs to do to enhance wellness, very top of our list. Next question is: do the phases of disaster repeat with a second wave of a crisis? Just want to remind people that the Spanish flu killed about 3 to 5 million people in their first wave, and about 50 million people on the second wave. So I hope that we don't see something like that now, but there may very, very well be a second wave. So the question has to do with the phases of disaster.
It is hard to really predict how we will. I do think we will go through the same phases in some ways, because if you think about it, like at least for us in the hospital system, it starts to feel like we are at a peak. And now I'm used to whatever is happening now feels like a little bit of a current normal. And if it continues for the next few months where we are all slowly starting to do a little bit more with careful distancing, that will become the normal. But then if there's a second peak and we start saying, wait a minute, whatever we are doing is not working, I do think that grief and anticipation will happen again. Though I do think it might be a little bit more attenuated than the graph you might see today. Now, one thing to remember is these graphs are not necessarily measured, and we don't really have data that says this is how exactly it happens. But that's the best I conjecture based on the knowledge I have.
Great. Yeah, I would say that the heroic and honeymoon phases may be more blunted than anything else. Maybe the disillusionment phase is even deeper than with the first wave, but no question that the honeymoon period may not be quite as high.
Sorry, just to add to that, not to bring a topic, today I feel like my job is to actually help you feel better in some ways. But the truth of the matter is that we can't forget that even before the pandemic started, the burnout rates were pretty high for us all. And so we also have to remember that. So for a little bit, we can band together and forget that things really are bad around us. But they come creeping in very fast. So it is also all in that context.
All right, next question. Psychiatrists. Just show a number about that.
Sure, let's see. Petrus, can you see the numbers without going into slideshow?
Yes, you probably, right here, yeah. I think that people can see them. I can see them.
So one is this number for everyone else, but the other number that was a physician provider line number, that's in this slide. This is the physician support line. So this is basically a group of volunteer psychiatrists have formed together to support other physicians. And this is pretty much 7 days a week line. So this is a good number to give to other physicians. Doctors and nurses are by a cohort, we are the kind of people who don't want to ask for help. So it does help to speak to other physicians because they understand what you're going through. So this is a useful number to share with others.
Right. And a follow-up question to that, how do I go about volunteering to offer a therapy group for essential workers? I would suggest to start with the people who are already doing this and ask how you can volunteer and how you can join forces with them, unless anybody has another idea.
And most organizations unfortunately, there's like not a New Jersey's physician support line is I actually was looking if there's a nurses support line or counselor support line. Physician support line is the only national number I found, but locally within each institution, there's a lot of work happening. So Rutgers has a support system for all the staff. I'm sure every individual hospital system has that going right now.
Okay. I may take a stab in the next question. Medical schools seem to have extremely high stress built into the system. Now with COVID-19, the stress is already high. Will the schools provide some more realistic expectations? Well, we have to. On the medical school side, we have moved as much as we could on the virtual platforms, but the actual work of seeing patients and treating patients still has to be done face to face. And of course, all that is delayed. We don't think we're going to start having the medical students back on the hospital at the hospital before July 1st or maybe August 1st. So all that has delayed their training and has made them quite anxious. Yesterday, I was giving one of those virtual review sessions for the medical students, and I took my cell phone with me and I gave them a tour of the hospital. They're not allowed to come to the hospital, but at least they could see what's going on and how we work the different aspects of the COVID-19 response, and that was greatly appreciated. So a lot of modifications on the medical school curriculum. They usually have 4 weeks of psychiatry. Next year, they're going to have 3 weeks of psychiatry. Everything gets somewhat contracted. And more responsibilities being put on our shoulders as faculty, where the requirement is that we will have to guarantee that our residents, for example, have enough training in different aspects of psychiatry before we graduate them. And we have more leeway in this respect, but also we have more responsibility in making sure that our residents are competent enough to be able to handle psychiatric care expertly and professionally in the future. Rashi, you want to say something about this?
Yeah, Petrus, one thing that I wanted to add was that during times of high stress, one well-being measure is really clear, consistent communication. So for medical students, things like whether we'll finish our clerkships or not, will I graduate on time, what will happen, or just even so sometimes just even communicating, we don't know what will happen, we'll work with you is very important. And at least in our med school at NJMS, I've been seeing that, the school associate dean and student affairs are really meeting with students very frequently and communicating where we are now and what we can't answer and what we will try to answer. So I think sometimes saying what we know and what we don't know is as powerful as just coming with the answers.
In that spirit, one of the techniques I use, and I have no idea whether it's a good thing or a bad thing, but I'll tell you what I do, is I quantify my uncertainties. Somebody will say, what are the chances that we're going to open the school on July 1st? I have no idea. Nobody really knows how this whole thing is going to play out. But if you really force me, I would say there's about no more than 20 or 30% chance that we're going to start on July 1st, and maybe another 50 or 60% chance that we're going to start by August 1st. And of course, these are numbers that come out of thin air, but I think it gives the impression, or it gives the comfort that I'm being as honest as I can be about the information that I have on my hands and the way that I read the tea leaves in front of me. So I wonder how people would judge this quantification of uncertainty that I use.
I actually find it useful. Oh, sorry, go ahead, Clem.
I'm sorry. On a separate note, I just wanted to add, I know with pharmacy school, and a lot of the curriculum and didactics may be similar, where students are very stressed out about taking exams. But I think that this opportunity, with these exams, most of them are probably multiple choice, etc. But I think with this COVID-19, at least the pharmacy school has been using more case-based learning and open-ended questions. So students are, applying a lot of the information they may learn from reading medical literature and stuff. So I think it presents an opportunity to still provide the education, but more through application based instead of like, answering a black and white ABCD multiple choice questions. So I want to add that.
I just want to add one more thing. One thing I've seen students do in our school, when you have a situation that's not in your control, taking control of some aspect of what you can do is very powerful. So I've seen students who have banded together to feed the community we are living in. So they can't do their regular medical practice, but they can feed the hungry. I've seen students come together and make appreciation videos for frontline workers. So some students held a virtual concert to provide some support and relief. So it's also like, when you're feeling uncertain and overwhelmed, it's also when you take a focus from yourself to how can I help others? So those are the other kind of things that have helped, or that I've seen emerge naturally from the students.
Yeah, absolutely. I'm on the front line as an ICU social worker. I see and hear nurses every day having breakdowns. They are exhausted and very stressed. How can I address this in a hectic environment without invading their privacy with their work environment?
First of all, thank you. Being an ICU social worker right now, where patients don't have their family members, it is a very stressful place to be. So you're doing a job that is essential. So thank you for doing it. Two, in some ways, you are dealing with this by wanting to help others who are really in a hard situation. The best thing one can do is to offer that you're there. And if somebody wants to talk as a peer, or even saying a simple, how are you doing today? Or you look stressed, can I help in any way? There are so many simple things. If we just asked, maybe there are things that would be useful. For example, a nurse might say, hey, at this point, having a coffee would be great, but I don't have time to get one, or simple things. But the most powerful is a listening ear.
If a healthcare provider feels overwhelmed at work, should they approach supervisors now or wait? It feels too much to continue coming to work, even though the healthcare provider is grateful for their job.
Want to say something, Petros, before I jump in?
Yeah, I think that you should approach your supervisor and talk about it right away. I think that letting these things fester will not result in the best ways to overcome it. So I think most of us who are in supervisory positions would appreciate that somebody comes to talk with us. If anything, I think the main issue that we have is that people who are extremely stressed do not come to talk to anyone, including their peers or their supervisors. So I think that this would be more appreciated than perhaps you may think.
I think that like, just to go back the question before, I think a lot of like nurses or staff or whatever, they don't want to speak up because for fear of retaliation or consequences. I think we see that in the news recently in some hospitals where, they say, don't come in then, they may be afraid of their jobs. I guess this is part of what's adding to the stress, that they don't know how to approach their supervisors, or the organizational structure that Dr. Agarwal was mentioning, the importance of the organizational structure helping to, make a more, a better work environment.
Yeah.
One other thing to remember is that you might have a supervisor who's really approachable. I think Clement and I are lucky we have Petros as a boss, and we can go and say, hey, this is how we are feeling. I think not everyone is working in an environment where you feel that what you're saying is appreciated or responded to. While we are waiting for the systems to change around us, it is important to take care of ourselves. And finding your community, if it's at work, your colleagues, your other nurses, that's wonderful. If it's not at your work, going outside of your own hospital, but maybe, there's a New Jersey Nurses Association, there's a national association, doing that work out, like there's so many organizations that you can find a home in, and finding the place where you feel like your voice is heard is really important. But if you are in the midst of 12-hour workdays, I think the most important thing is to focus on taking care of yourself one step at a time. And then when you have more energy to do all of these things that will make you feel that your voice is heard.
Let me put a plug here for social media. Social media have been demonized, and I mean, in our group here, we study internet addiction and technological addictions and all that kind of dark side of technology. And of course, that's very, very valid. But social media have played a very significant and helpful role in quarantining and social distancing and so on. So if you haven't, very much like Rashi said, if you haven't found your community at work, social media may be a major avenue for you to find that kind of support. Everybody knows about Facebook and Instagram and Twitter and so on, but there are other platforms, emerging ones that can be extremely helpful in connecting people. So don't always blame the social media as being a bad kind of thing. It can be very helpful in supporting us during a crisis. All right, next comment comes from Kim. Thank you so much for this. I'm glad you spoke about the guilt piece. I'm a social worker and struggle with feeling guilty because I'm not on the front line or volunteering and needing to keep myself safe. Can you recommend any ways to volunteer from home, maybe with phone calls, emails to vulnerable people, etc.?
If you're not in an organization, actually in the Q&A, Petros, I see that somebody has listed a place where you can go for volunteering.
Okay.
Where is it? So there's a COVID place. I don't know, I just saw there, somebody had posted a link for volunteering. Oh yeah, it is basically covid19.nj.gov/form/volunteer. So I think if you just Google.
A little slower, just say it again.
It is covid19.nj.gov /form/volunteer.
I screwed it up once again.
covid19.nj.gov /forms/volunteer. But I think if you just Google it, you should be able to find it.
Okay, great. All right, going to the next one. Can we talk more about the importance of physical activity in managing stress levels and reducing the symptoms of anxiety and depression? If I can take the first stab at this one, a couple of things there. One is that Rashi talked about the three pillars of physical health is in nutrition, sleep, and exercise. A lot of us feel that there are four pillars of physical health, and they are nutrition, exercise, sex, and sleep. So don't forget about the sexual function. Don't forget about that major component of our lives, and find some ways of addressing that fits within the new realities of social isolation and quarantine. Specifically about physical activity, go back to the idea of safeguarding your routines and developing new routines to accommodate the new realities. This is the mantra that should keep on coming over and over and over into our heads. So a lot of us like going to the gym. There are no gyms anymore. They have closed. So we have to find other ways. Maybe order from Amazon some of those home equipment that you can use, or take up bicycling. Bicycling is something that can be done even within the confines of social distancing, because you just go really fast past each other and in places where there may not be that many people. Develop new routines, develop new ways of forcing yourself to wake up at the same time, go to bed at the same time, put in that exercise in there, always with a mind of normalcy, of instilling your mind with a sense of normalcy.
Speaking as someone who's not as active as Petros is, walking is the best form of exercise where I'm concerned. Using stairs when you can. So honestly, nowadays it's even more recommended because elevators, you want to avoid elevators. So use stairs when you can. That's the best way to incorporate exercise. But go for walks, even though many national parks are closed. neighborhood parks, as long as you maintain neighborhood walks, I mean, as long as you maintain a safe distance from others who are out walking, is a great way to be outdoors. And then just having a couple of weights at home and doing, maybe inviting friends for challenges. Like, I don't know if Clem can hold a plank for 40 seconds or not. Let's have a challenge, Clem. Things of that kind. Make it fun.
Thank you, Dr. Agarwal. I found this informative. I can relate as I do practice meditation regularly, gratefulness and yoga, and do find them helpful. My question, I'm a psychiatric nurse and work at an inpatient psychiatric facility. There's a lot of negativism, negative commentary, which spurs on more negativity. Do you have any recommendations to try to turn this around? It's so destructive.
That's a hard one because it's the way our brains are wired. So, for example, if I see a colleague and I start by saying, "Hey, our boss is so wonderful," everybody around you will be like, "What's going on here?" The way we connect to each other is by saying, "Oh, the traffic was bad," or "Our bosses are worse," or "The coffee's terrible," right? Like, in some ways, negativity makes it easier to relate to each other, and that's what makes it go into a vicious cycle.
That's a great idea.
So it is very hard to do so. One, first take yourself out of it if you can. Don't contribute or engage in it. Like, it is a very tricky balance to do, but then slowly bringing in some things you are grateful for. And then sort of maybe, and by the way, all my slides, anyone who wants to use them, please use them freely. So educating people about how it works. So getting into a habit of maybe sharing one good news from the day, or sharing some funny videos of cats, dogs, anything that connects you from laughter and humor rather than the negative cycles. It can be a big challenge.
Okay, I know we're only close to time, so I'm gonna choose some of the questions here. I'm a social worker doing telehealth. Do you recommend disclosure of my own anxiety, depression, and uncertainty as an intervention to help my clients cope? Excellent question. I can start the discussion.
Go ahead.
And I would say no. Mostly no. Primarily no.
I disagree with Rose. Wonderful.
I think that you need to be real in therapy, but opening the door to start discussing your own problems. We've seen it done so frequently, and it's not helpful to the patient. It may be helpful to yourself, but this is when you need to go to your own therapy. This is when you need to have your own support. Don't take your patient's time to vent your own frustrations. I think that's a general advice in psychotherapy, and I think that this should apply in telehealth as it applies in the therapy room.
I completely agree with you, Petros, that in a session, you're focused on a patient's need. And I think those of us who were psychodynamically trained were trained to not bring in our own and be a blank canvas. I have to admit, in the last 5 years, what I have seen is careful disclosures, when appropriate, actually helps that bond. Like, I've seen a number of times where a patient of mine will say, "Oh, by you telling me that this happened to you in the same way made me feel more normal or better," and helped clarify. So if you have, I think what Petros said about working it out in your own therapy is really important, because if you haven't worked out your emotions, and in a session then is the first time you say, "Yes, you're feeling that too," then you might take over the session unintentionally. But if you have worked out your emotions, and then you share that, "Yes, I felt grief or guilt or worry," and like, especially, and it also depends on what kind of therapy you're doing. So if it is more supportive versus it's much more psychodynamic. So I think it depends on the spectrum of that too.
I'm going to insist here. There's a lot of distance between being a blank screen and going all the way to, "Let me tell you what my day was like. Let me tell you what I did today and how I dealt with this." And I've seen that second part just so much more encouraged even in 2020 that always with the excuse that we don't want to be blank screens. That of course we don't want to be blank screens. That is done. We put it aside. Don't abuse the patient's time with our own problems. It's just not helpful. And we see that, of course, in substance use disorders very, very frequently. Let me tell you how I did it. Let me tell you how come I'm sober. And that's the way that you're going to find salvation as well. Okay, we covered the volunteer line. Any suggestions regarding the best way to reach the administration to help them shift to recognize the needs of medical staff by meeting their needs? I think we addressed some of this as well.
Advocacy, and speaking out where it makes sense. I think the one thing to keep in mind is there's a saying that sort of says, help me understand what I can change and give me the power to change that, but also have the wisdom, like I don't remember the quote properly, but the wisdom to know the difference between what is your sphere of influence and what is not. So if I try to change the whole healthcare system today and think about that, then all that will happen is that I'll get depressed and negative. But if I only focus on things that I can influence, that gives me control and power. So sort of keeping that in mind.
Great. Can you talk some more about the guilt feelings that high-risk doctors may have who are not able to go to the front lines?
Guilt is such a shared emotion. And again, so, you know, if you are immune suppressed in some ways, or you're living with older people, or whatever your individual reasons are where you can't be there in frontline, as physicians, we're trained to step in and be there to take care of others. So when we can't do that, the feeling of I should be the one doing that is very powerful. I think the way to sort of make sense of that guilt is first acknowledge your guilt, recognize that it is real for you. It doesn't matter what the reason is. And then figure out a way to deal with it and accept it. Let me rewind. Instead of trying to solve the uncomfortable feeling of guilt, sit with it and accept it, and take a few moments to say, yes, this is what I feel. And then the solutions will emerge. I'm sure you're contributing in your own way. Even if your contribution is just keeping yourself safe and your family safe, that is important. And we all are doing altruistic things in our own way to compensate for that guilt. But the first step is it's uncomfortable, but it's okay to feel guilty.
Okay. Dr. Agarwal, I agree with you. Careful and selective disclosure can help validate the patient's perspective. And now, Dr. Levounis, I agree with you. Where was that? Where are all these comments? There must be a bunch of Dr. Levounis, I agree with you comments. Don't see them, they're not there. So Dr. Agarwal, you win, and people agreeing with you more than they're agreeing with me. So be it.
We will continue our conversation offline, Petros.
And with everybody else, we're going to continue the conversation next week. Next Friday, we're having our final echo for this series. I so much want to thank Rashi for doing this one today. I couldn't be more central to our work. Next week, we'll have a guest speaker, Dr. Frank Inasi, who is the president and CEO of Rutgers University Behavioral Healthcare, also vice president of Barnabas Health. He's going to be talking about next steps. So what's going to happen after COVID-19, how we're going to rebuild, how we're going to address the disillusionment and the pain that's going to follow the surge and the acute phase of the pandemic. So with an eye towards the future, we're going to have a session next week. The three of us are going to still be here, but we're also going to have Frank joining us as a guest speaker. I also need to say here that the session has been recorded and it's going to be available from the ECHO COVID-19 webpage. Thank you all so much and have an absolutely wonderful weekend. Thank you, Rash, again. Bye-bye, everyone.
Thank you.